For many people who have been admitted to a hospital intensive care unit, recovery does not end once they are released to go home. For most, life after an ICU stay is filled with unexpected challenges.
Yeah, doctors are now learning more about patients with PICS or post-intensive care syndrome and the best ways to help them recover. Marty Salt has more.
Connie Bouvier enters the hospital with open arms to hug the medical staff that saved her. Last May, she walked into the emergency room and collapsed. The first thing she remembered?
My oldest son looking at me saying, "Mom, do you know where you are?"
Connie spent 22 days in the intensive care unit with pneumonia, sepsis, and blood clots in her lungs.
Her respiratory failure was so severe, in fact, that she needed to be paralyzed for a prolonged period of time and flipped onto her belly in the hospital bed in order to increase the amount of oxygen that we could deliver to her bloodstream.
Connie survived the deadly infection. She's used to beating the odds, breaking barriers in the 70s as one of the first female telephone splicers. This single mother of 5 hates feeling afraid and weak.
I can't even put like a water pitcher in my fridge.
Dr. Butcher says U.S. experts are just beginning to recognize the combination of physical, cognitive, and mental health issues like depression and anxiety that plague patients once they're discharged.
Cognitively, they may find that they have difficulty remembering things that they could easily remember in the past. They may have difficulty concentrating or paying attention to something.
Last year, Dr. Butcher developed a critical illness recovery center. ICU patients are evaluated shortly after discharge and then referred to specialized physical therapy, occupational therapy, or speech therapy. Critical support for patients on the very long road to recovery.
This is the journey to my best life.
She's here to enjoy her family's big days. For News 8, I'm Marty Salt with today's medical breakthroughs.